is really causing the hepatitis A outbreak in southeast Michigan? In the past week, we've seen outbreaks of the disease due to poor hygiene by customers or workers at restaurants. As a result, whenever someone who works or eats at a restaurant gets sick, we get an alert. The Now Detroit's Kim Russell is live right outside the American Red Cross, where it is now changing the questions it will ask donors. Kim.
Yes, it appears the American Red Cross is taking action to protect blood recipients. People who are donating blood say they're noticing a new question on the little surveys given as you make sure you're eligible to give blood. They're being asked if they've eaten at restaurants where people have either gone out to eat or worked after being diagnosed with hepatitis A. In the meantime, health experts say this hepatitis A outbreak may actually be being caused by something different entirely. There is no doubt the hepatitis A outbreak is a problem. The numbers don't lie. Take Macomb County, for example. The county health director says in a typical year, they see up to 10 cases. So far this year in Macomb County, there are 177 confirmed cases of hepatitis A. The numbers are up across southeastern Michigan, with the state confirming 583 cases in the last year in the region. 20 of those people who became sick died.
Hand hygiene, vaccination, those are the two ways to prevent it.
Dr. Matthew Sims is director of infectious disease research at Beaumont Health. He says while we know how to prevent it, figuring out how this outbreak is happening is a challenge. What they do know is while in the past such outbreaks have at times been caused by poor hygiene at restaurants, that's why you see signs like this in restaurant bathrooms. This time, in the vast majority of cases, that doesn't seem to be the case.
So this is not the classic outbreak where somebody gets sick in a restaurant and then it spreads from that person to people who ate with them and then to family members. Nobody has found like one source outbreak. It's all been sort of this diffuse, related to heroin abuse, related to homelessness, related to incarceration, and then cases that we just can't quite figure out where they're coming from.
Dr. Sims says an extraordinary number of hepatitis A cases recently diagnosed have been connected to heroin abuse.
Because they're sharing needles, it's blood exposure.
So while everyone's paying attention to where people go out to eat or where they worked when they catch hepatitis A, because of problems we've had in the past, it just seems that things are changing right now with the outbreaks that we're seeing currently. One big thing, get vaccinated, doctors say, and that will protect you. Reporting live, Kim Russell, The Now Detroit.
Kim, I got to ask you a question about the vaccine. How long will you be protected if you get it?
I asked Dr. Sims that, and he said if you get the vaccine once, you're protected for life. So he says it's a great thing to do.
I guess so. One and done. All right. Thank you so much for the live report, Kim. Joanne?